So I'm going to explain to you shock. Now, I like to explain how the circulatory system works. And shock is really where the circulatory system is affected and distribution of blood around the body to all the organs, tissues. So this is the brain, the skin, liver, kidneys, etc. It's not undertaken because there's a failure in the system somewhere. So we will start with the circulatory system, and the main part of the circulatory system is the heart. The heart itself is divided into 4 chambers. So we have here, this is the right, I know it's on the left side as you look at it, but the right atrium, RA, and over on the other side here is the left atrium, LA. Down the bottom here with the 2 bigger chambers, these are your ventricles. So we have on this side the right ventricle and the big ventricle down here. This is the main ventricle that pumps blood around the circulatory system. So this is very big, and the muscle around this ventricle here is much larger when you compare it to other muscles around the other atria and the ventricles. And this is because the heart needs to squeeze, get a good pressure going, and actually push blood down to the legs, and from the legs back up, and also up and into the brain as well. So blood will classically leave the left ventricle, and it will leave the left ventricle, and it will go out of what we call the aorta. So it's a big artery that comes out the top of the heart, goes over the aortic arch, and it will carry on down to the back and off to all the big vital organs and around the body, down to the legs, etc. For my picture here, I will show the blood leaving the left ventricle from the left ventricle itself. So we have a big artery traveling off, and this blood here has lots of oxygen in it, and it is going to the cells. So let's have some purple for the cells. So these cells, like we said, are your organs, skin, tissues. These will all require oxygen to survive. Now, like a car, we put petrol into our car, and the motor there will burn that petrol. However, it will produce waste gases. And this is what's happening here to the cells. Your body there is taking blood to the cells, the oxygen, the petrol, effectively. That oxygen is being burnt and producing waste gases in the form of CO2. Now, the CO2 will be put at the same time as it takes oxygen away back into the blood flow, and it will then be put back into the bloodstream and sent back to the heart. This time, the blood will travel, so with less oxygen but more waste gases, and it will turn itself into the right atria. It will go through the right atria, and there's a valve here in between the atria and the ventricle, through that valve and into the right ventricle. This deoxygenated blood will carry on through, builds up a bit more pressure, and it comes out the pulmonary artery, and it will travel off towards another big and very important organ. It will travel towards the lungs. So here's our lungs. Now here we have the reverse what happened in the cells. Here we have deoxygenated blood. This deoxygenated blood will go into the organs, and it will push away its waste gases. At the same time as we breathe in, well, air around us is generally around 20% oxygen. We breathe in 20% oxygen. That oxygen will be perfused into the bloodstream, and at the same time, the waste gases are expelled. So we will then breathe out, getting rid of our waste gases, and we would have breathed in, increasing our blood oxygen. This enriched blood travels back to the heart and it goes back into the left atria, through the heart, through the valve in the middle, and then back into the left ventricle where the process is repeated. So effectively, your heart is a figure of 8, and it's 2 pumps connected together and working as a system. They're pumping blood around the circulatory system. This is your circulatory system, around the legs, to the brain, all around the body, and also around the pulmonary system, where we get rid of the waste gases and we pick up our oxygen. So in shock, something within the system has failed, and this process of taking on new oxygen, getting rid of waste gases, putting it around to the cells and organs fails. So we can have cardiogenic shock, for example. Now, cardiogenic shock could be related here to the heart. If you take a heart that is 90 years old, for example, I can guarantee you the heart is not going to be as effective as it was when it was 5 years of age. So the heart itself can fail or lose its power. It's the same with a pump in a swimming pool or a fish pond. Now, if you had a pump that was a few years old, it would probably have a lovely big water feature and work perfectly well. However, if your pump was 90 years of age, it probably wouldn't be as effective, and it would probably need some maintenance and repairs doing onto it, which is your surgery, for example. So this could be a form of shock, cardiogenic shock as well. There are other reasons the heart can fail. Another form of shock could be hypovolemic shock. So hypo, we know, is low. So if you are hypothermic, you are cold, your temperature is low. Hypo for hypothermia is low, thermia is temperature. So, but hypo, and then we have vol, which is for volume, so low volume of blood, anemic, so low blood volume. So how can we become hypovolemic? Number of ways we can become hypovolemic. Ooh, apologies, rather a big knife. So we could have a knife go into us. Here we go. Let's try and draw a knife. And what's going to happen when we get a knife put into us? We are going to get squirty, squirty, blood coming out. So we're going to lose blood volume. And as a result, the pressure here in the systemic system is going to drop, and the heart may fail to deliver the blood it's required at the cells because of the drop in blood pressure. So as first aiders, what we can do is immediately plug that hole up, and although we're not going to add fluid and put the pressure back up, we can hopefully stop that blood pressure from dropping or continuing to fall. Other reasons we can get hypovolemic is, there's our little person. A couple of other reasons. Have a think of why you think might become hypovolemic. I will show you. I will select, what colour? Green, I think. Vomiting. So prolonged vomiting. 24 hours of vomiting, as long as you're replacing those fluids, it's absolutely fine. But prolonged 2 to 3 days of severe vomiting and diarrhea can lead to hypovolemia. So it's very important with severe diarrhea, vomiting, that you take the correct fluids, the salts as well, the sodium in there, to try and keep your sodium levels up and your fluid levels up to maintain a good circulatory system. So very important, especially with children. So that'd be a hypovolemic shock. We also have distributive shock as well. Now, distributive shock is really very complex complicated. But a form of distributive shock might be, let's go for orange here, sepsis. So sepsis, when you pick up an infection within the bloodstream, it can irritate the walls, the linings of the blood vessels itself. And those blood vessels can release, when they're irritated, a drug called histamines. And histamines can make your blood vessels very dilated. So let's go to red. So the blood vessels dilate, meaning get larger. And as a result, we drop our blood pressure. So if you have a 5-litre bucket of water with 5 litres of fluid in it, the bucket will be filled to the brim. However, if you were to have your hands in the bucket and stretch it wide open, make that bucket much bigger, you've still got the 5 litres in there. However, the fluid volume will drop down. You'll start to see the water levels fall. And that's very similar with dilation of the blood vessels. Another problem with sepsis is this histamines being released and irritating also causes a little bit of fluid loss in between the capillary beds, the blood vessels, and the cells. And this fluid loss, will get in between the cells and the blood vessels. So as oxygenated blood here travels up and towards the capillaries where the exchange of the gases is going to take place, the fluid will get in the way, interfere, and it will stop the allowance of transformation going through from one to the other. So oxygenated blood will travel on through, perhaps not distribute as much oxygen as it like, and carry on past the cells, and at the same time the cells will not be able to breathe out or get rid of those waste gases. So it's a bit like blocking up your exhaust pipe, and these cells are going to become poisoned by their own waste gases, and as a result all the cells around the body can be affected, leading potentially to a fatal response. So multi-organ failure and sepsis is extremely important, and it's recognised nice and early. It's treated correctly with antibiotics in hospital. Fluids are pushed through as well to keep the blood pressure up and to maintain a good circulatory system. So that is your sepsis. Another form of shock is an obstructive shock, and this here is your blood vessels, perhaps in your leg, and you happen to have in here a blood clot. Now this blood clot will travel, if it becomes loose, down through the right side of the heart, carry on down and into the pulmonary system. Now the blood vessels on this journey here are nice and wide, nice and big, and this clot will most likely fit down through. However, as we go through and into the lungs, the blood vessels branch off into lots of thousands of little vessels, and they become very small. And this is to increase the surface area and to allow the gases to exchange from one side to the other. Now, as this blood clot comes into the lungs, these blood vessels get smaller, and all of a sudden it gets stuck. Now, very much like a heart attack, where part of the heart doesn't receive the oxygen it requires to function, this is effectively, you could argue, a lung attack. And we know these as PEs, pulmonary embolism. So this is the pulmonary side, and embolism, this is your embolism within the pulmonary system. Now what's going to happen here to affect our circulatory system is the deoxygenated blood is going to travel through and into the lungs. However, as it passes through, the function of the lungs is hugely affected by this big embolism blocking up the lungs. So blood will travel in through, and it will potentially pass through, and it won't have picked up the oxygen really it should have done, and it will travel through. So people in this form of shock, you will see becoming slightly blue, cyanotic or hypoxic in colour, as they're picking up less oxygen in the pulmonary system there in the lungs. And also you will see their respirate increase as well, because they are having to now work harder to push more blood through the pulmonary system to try and increase the blood flow and the blood volume of oxygen around the body as well. So there are main types of shock. There are other forms as well, neurogenic. Neurogenic gets very, very complicated as well. With these forms of shock here, pretty much all patients will display with the very same signs and symptoms. If we have less blood volume, our heart will need to work harder to increase the blood pressure that we're losing, and also push it through the lungs to pick up more oxygen and distribute that more quickly. So most forms of shock, pretty much all forms of shock, you will see an increase in heart rate. However, the blood pressure will continue to fall. So if you do feel for pulses, you will probably find you have a weak pulse. And these patients will feel very weak, tired, lethargic, potentially sweaty as well. So that is why with patients in shock, we like to lay them down. We also elevate those legs as well, because there's an awful lot of blood in the circulatory system here that is in the legs. The legs aren't vital. We've got the big organs in the chest, the abdomen and the head that we need to keep oxygenated. So we will elevate those legs, use gravity to help support blood flow to the brain and keep the patient alive. Neurogenic shock is slightly different. This is where the brain can be affected. So people with severe head injuries can go into a form of neurogenic shock. With neurogenic shock, we see quite often the reverse. So you will see someone go very red in the face with the increasing levels of CO2. And as their CO2 increases as well, their blood pressure will, well, bizarrely broaden, so you'll get very high blood pressures as well, big bounding pulses. If you feel someone with a significant head injury, you'll get big bounding pulses. Even if they've lost blood at the same time, the head injury symptoms will take over. So hopefully that makes more sense of shock. Carry on through the slides in our first aid course. It breaks it down a little bit more into detail at each different type of shock. And thank you very much.